Hello, good morning to Miss Aina and my fellow friends. Today I'm going to present about the misconceptions and myths about aphasia. So, have you ever met someone who struggles to speak after stroke or brain injury? Many people assume they lost their intelligence or that they just need to try harder. But what if I told you that's just a myth? Today I'll be talking about aphasia, a language disorder that affects communication but not intelligence. So there are many misconceptions and myths about aphasia. And these misunderstandings can create unnecessary stigma and challenges for those who living with it. So let's debunk some of the most common myths. So aphasia is often misunderstood, leading to various misconceptions about its effect and recovery. So many people mistakenly believe that it affects intelligence, that all types are same, or that individuals with aphasia simply need to try harder to speak. But in reality, aphasia is a complex neurological condition caused by brain damage, affecting language processing while leaving cognitive abilities intact. Dispelling this myth is essential to foster better understanding, empathy, and support for those living in aphasia. So, misconceptions and myths about aphasia. So, myths, aphasia affects intelligence, where one of the biggest myths is that aphasia affects intelligence. So, people with aphasia may have trouble finding the right words, but that doesn't mean they are less intelligent. Their thoughts, ideas, and knowledge still remain intact. It's just the ability to express them that is affected. Imagine having a perfect sentence in your mind, but not being able to say it out loud. That's what many people with aphasia experience every day. So, for the myth two, the second myth, people with aphasia cannot communicate at all. So, like another common myth is that people with aphasia can not communicate at all. While some may struggle with speech, many use alternative communication methods such as gestures, writing, or assistive technology. There are apps and devices that help individuals express their thoughts without speaking. So just because someone with aphasia has trouble speaking doesn't mean they can't communicate in other ways. For myth number three, which is aphasia is a type of dementia. So here is many people confuse aphasia with dementia, but they are not the same. Dementia is like a progressive decline in memory and cognitive function, like a thinking disability to think properly, while aphasia is a language disorder which caused by brain damage. A person with aphasia may struggle with words but still have sharp memory and problem solving skills. However, there is a type of aphasia called primary progressive aphasia, which is PPA, which worsens over time and is linked to dementia. But in general, aphasia itself does not mean memory loss or cognitive decline. Yeah. Myth number four, which is all aphasia is the same. Aphasia comes in different forms. Broca's aphasia affects speech production, making sentences short and broken, while Wernicke's aphasia affects comprehension, leading to fluent but often nonsensical speech. Like uh, they can properly communicate, but the meaning is meaningless. Like there's no meaning at all. It's just mumbling gibberish. Yeah. So like other types like global aphasia affect multiple aspects of communications. So each type presents unique challenges. So saying aphasia as if it's one condition is actually misleading, because there is also another type like global aphasia, conduction aphasia, and anomic aphasia. Yeah, something like that. So myth number 5 is people with aphasia should just try harder to speak. This is like some people think that those with aphasia just need to try harder to talk. But aphasia is caused by damage to brain's language centers, and no amount of willpower can instantly repair that. Imagine breaking your leg and someone telling you to just walk. You can just walk when they're telling you you can just walk, but can you imagine like you're breaking your leg with someone just telling you just walk? It's easy, right? It's like that. So speech therapy and rehabilitation take time, patience, and the right techniques to help people regain their communication skills back. So myth number 6, which is recovery from aphasia is quick and complete. So here's is some believe that aphasia recovery is quick, but that is not always the case. While some individuals regain speech within weeks or months, others require years of therapy, and some may never fully recover. So factors like the severity of brain damage and access to speech therapy play a huge role in recovery. So the key is ongoing support and patience. Yeah. So for the myth 7, only stroke patients get aphasia. So people believe that aphasia is most commonly caused by strokes, but it can also result from traumatic brain injuries, brain tumors, like infections, and neurodegenerative diseases. So this means anyone can develop aphasia, not just stroke survivors, and doesn't matter if they are old, young, or just a young adult, a teenager. Yeah, it doesn't matter. Anyone can get aphasia. So that's why awareness is so important. It can happen to anyone at any time. So yeah, now that we have busted these myths, I hope you understand aphasia better. It's not about intelligence, and it's not the same from everyone. People with aphasia can communicate in different ways, and recovery is a journey, not an instant fix. The best thing we can do is to be patient, understanding, and supportive. Let's spread awareness and make the world more inclusive for those with aphasia. Thank you for listening.